about acupuncture for your horse tonight. Hopefully you came to the correct talk. Okay, so I'm the one that does the acupuncture here at the clinic, do most of the rehab and that kind of stuff as well. So acupuncture can go along with any other treatment, realistically. There are pretty much only a few exceptions that it could not potentially benefit. Okay, so we're going to go through kind of what happens and all that kind of fun stuff. So, the history, just a little bit. Not a lot, because I don't like history either, so just a little bit of background on it. Okay, so that one says, do you guys want me to read you the cartoons?
Yes, please.
Okay, so that one says, that's odd, my neck suddenly feels better, and he's getting pummeled by spears. So that's the early form of acupuncture. Okay, so it's been around realistically forever. We've been using it to treat animals for about 4,500 years. It transferred into human medicine about 3,000 years ago. Traditional medicine, Chinese medicine, started, of course, China and that part of the world, and has worked its way over to us here in the Western world. So, entered the U.S. So up until about the 1700s, it was primarily Asia and Europe. Entered the United States and this part of the world in about the 1970s. So it still wasn't all that popular here in the United States, and it has kind of waxed and waned as far as people using it and then not using it and using it again. It became popular here in the United States in realistically 1972. One of the political journalists that was traveling with Henry Kissinger was exposed to it after he had an appendectomy while he was in China. They used it to treat his post-op pain, and realistically he brought that back to the United States, that knowledge, promoted acupuncture, and it began to get more popular here in the United States. So it is realistically, it's based on a holistic approach, and there are two kind of separate thoughts on acupuncture. There is a traditional Chinese or an Eastern medicine version, and there is a Western medicine version. Really, a little bit of a different thought process on how it actually helps heal the body itself. Okay, so it utilizes the own body's mechanisms, the natural repair mechanisms, pain relief mechanisms, decrease in swelling and healing that are already present in this case, the horse's body, to help promote healing, help decrease a pain response, help promote healing. So, how does it work? So, it does involve insertion of very small needles. I'm going to pick up my mother, and we brought her car, and I forgot the needles, so I'm so sorry about that. They're usually in my truck. So, but the needles are very small. I've got some picture examples for you in the slides. But they go into specific points. They're called acupressure points, and certainly there's some literature. I know there's some books out there that describe the different acupressure points, and some of the points that are close to the surface of the skin, you can put pressure on those and find a response to that as well. Okay, and certainly anyone that researches that a little bit can perform that on their own horse. So the points themselves, where they stimulate, is they're in areas that lie close to major blood vessels, so particularly blood vessels that are more towards the skin. They also tend to lie in areas where there are nerve endings. Oh, I see we have some. I think these are not the ones that they can use though. Oh yeah. Oh yeah. So, okay. Let me see, hang on. Hold that thought, you guys. So you can try it if you want. You don't have to. These are going to be little bigger horse size, but they're still really small. I will show you what to do with them here in a couple minutes, okay?
I don't think so.
Oh, be brave.
Are you brave on your dog? Are you going to do that?
Wait, no, no, my dog.
So I wondered how much was in it.
Okay,
Pretty good size.
It's fairly thin.
so what you're trying to do is stimulate those little blood vessel endings and or nerve bundles right underneath the skin.
Is that acupoint? I'm
No, just hang on 1 second, I'll hang on the needle. Okay, so another very common concept to keep in mind is that the nerves also tend to lie, that nerve endings in particular, lie very close to where muscles are. So where they enter or exit a muscle, typically that's right at the end of the muscle belly. So when I palpate, when I go to feel the horse, how I find those points is I find the little dips in between the muscles or in between one group versus another. Okay? So this, I know you can't read it, but this is an example of a nerve coming up through the tissue in the horse, coming right underneath the skin, and then you have a fan of nerve endings that come out, and that's where you're going to stimulate. So kind of the good thing about this, well, it actually is a good thing, you don't have to be, and it's better not to be directly on top of the nerve ending because that's going to cause more pain. You just need to be in the area around the nerve so that you can stimulate those muscle fibers in there, which are in turn going to turn around and signal the nerve to do something. Send a signal back to the brain to say, hey, I know it hurts, I know it's damaged already, you don't need to keep sending signals to say that it hurts. Decrease swelling, increase healing, it just depends on what it is that you're actually stimulating. Okay? So the trigger points, the points that we use to stimulate the nerves, they could be all the way on the other end of the horse. It just depends on how the nerves travel through the system. So where the needles are inserted may not necessarily be in the same area of where you're trying to treat. And that is in part why we treat the whole horse versus one particular area, because the nerves go all directions within the horse itself. So different nerve endings are going to stimulate different portions of the body, not necessarily right next to the area you're trying to treat. Does that make sense to everybody? So you probably have heard this, especially in traditional Eastern or Chinese medicine. The points are grouped together in pathways that are called meridians. And so this is an example of a meridian chart on the horse. So it's not that the nerves travel that direction, it's just that the points lie in those particular areas for different nerves, and they have them grouped together so that it makes it easier to recognize what areas of the body that you're stimulating. It makes it better for record keeping and to track the patient response so that everyone that would be involved in that horse would know, okay, this point was stimulated and it was to treat this area. So it's a way to standardize what the areas that you're treating. Okay, so this is just another little chart to tell you kind of what happens. So when you insert the needle, we're coming up to inserting it in yourself here real soon, okay? So be patient. When you insert the needle, and this, realistically, it happens no matter what needle or any foreign object that's inserted into the body. You cause what's called microtrauma. So that means you cause little damage to, in this particular case, most commonly muscle fibers. So the muscles themselves are made up of You could think of them as fingers that run together, or a group of spaghetti, you know, strands of spaghetti, how you have the long strands together, especially if you take a handful of them. So they run the same direction. When you insert something into that area, you always cause some damage, no matter what it is that you're doing. So that would include things like vaccines, any of the joint supplements, Acupuncture in particular is one I can think of, any kind of, if you give antibiotics through the muscle, anytime you do that, it's inherent that when you stick that needle in, you're going to cause a little bit of trauma. That's just a virtue of putting something into the body itself. Okay, so it causes that little muscle fiber damage. It also causes neurovascular reaction. So that means it causes the blood flow to change. It causes a nerve ending to be stimulated so that it says, okay, there's something foreign that's going into that area. So if you think about vaccines, when you stick the needle in the horse's neck, for example, most of the time they're pretty good about it, but they do react in some way, right? Even if it's just like, ow, they do something. They can feel it, and part of that is that you're stimulating nerves in there. Okay, you're causing some damage to the tissue, and the nerves are turning around and saying, hey, there's something that's foreign in here, it's caused some change, and now we need to do something about it. Okay, so most of the time it's not that big of a deal, and it's a quick, easy, done, and they carry on with life and no big deal. If you've ever had anything, your vaccines, that kind of thing, right, it doesn't feel that great. I mean, it's a quick 2-second out and you're done, and go on for the most part, right? So this kind of does the same thing on a much, much smaller scale though. Okay, so these needles, those of you that have pulled them out already, they are really tiny diameter needles. Okay, they may look long, but as far as what's going into the horse itself, it's a really small area. Okay, so when you cause that trauma, so here's the acupuncture needle going into the skin and down into the muscle belly. You cause the cells in there, cause a little bit of damage, cause the cells to react. They send a message to the nervous system. So this is a nerve that's going from that muscle, for example, up into the spinal cord, and sometimes that area takes care of things itself. It sends the signal up to that area, and that somewhere in the spinal cord says, okay, we need to do this. We need to increase the blood flow to that area. We need to decrease the pain response. Kind of depends on what it is. And so sometimes that signal just stops there and goes right back out to the tissue. Sometimes, and it kind of depends on what it is that you're stimulating, sometimes it'll go into the spinal cord, and then that signal transfers from the spinal cord and it transmits a signal up to the brain. Okay, and then the brain responds and says, okay, we need to change something. Okay, decrease inflammation, whatever it is. Okay, so that is what happens with this kind of response. So there is a signal going in, there's a signal going out. Okay. So again, on this is particularly a spinal cord response. So again, the needle goes into the tissue, stimulates the nerve endings, the nerves take the signal up to the spinal cord. The spinal cord can handle it on their own. They don't need somebody higher up than them, i.e. the brain. They can handle it on their own. And they send a signal back and tell the muscle tissue to contract, for example, or to stop twitching, whatever the case may be. Okay, so again, this is going to stimulate changes of the nerve endings or the muscle fibers. So therefore, the needle does not have to be directly touching a nerve. It does not have to be inserted into a blood vessel. Some of the acupuncture, they do what's called bloodletting, if you've ever seen that, particularly around their feet. So there is some theory that releasing the pressure on the blood is going to help resolve some of the soreness in the horse's feet. You don't 100% always need to do that, however, because even if you put the needles into that area, you're still going to get a tissue response. Does that make sense, everybody? Okay, so this cartoon says, hey, I'm seeing this new acupuncturist and now my back doesn't hurt and he's got arrows sticking in his back. Okay. It's always, you can see it plain as day on the computer, sometimes not so much on the screen. Okay, so the local effects, the things that are going to happen in the tissue right around the needle. One, you're going to get capillary dilation. So the really small blood vessels that are right underneath the skin, they're going to open up. And that's going to increase blood flow to the area. Okay, you're also going to get some immune activation. So your immune system is what's responsible for helping you not get sick. So sometimes it doesn't always have that effect, right? Sometimes it's not quite enough. But any kind of stimulation on the on the immune system in general is going to help, particularly with the decrease of the pain response. It is going to help with tissue repair activation, so it's going to make the body say, hey, there's some damage here, let's send some worker bees over there to help repair the damage. So, you know, the pothole gets filled by Caltrans. Okay? Or not. You also are going to get some local or what's called supraspinal control. So again, this is directly in the area that you are inserting the needle. It also is going to have an effect elsewhere on the body depending on where that nerve is traveling from or where it is grouped together as far as does it. For example, if I put a needle kind of towards the flank of the horse, sometimes that will treat bladder problems, sometimes that will treat intestinal problems. It just kind of depends on where that nerve is traveling from. Okay? So, ultimately, for the most part on the acupuncture, particularly with the horses, we're primarily trying to make them feel better, right? I mean, that's the goal of everybody. So, reduce inflammation, so decrease pain response, decrease swelling, decrease tissue response in there, and to realistically, quote unquote, normalize circulation. So in an area that is damaged and the blood flow is not quite as good as it could be, trying to get that reestablished. Okay, so trying to get the traffic flow going instead of being stuck on the 91 freeway trying to get out to Norco at 5 o'clock. Okay? So this little diagram just kind of reiterates that. So the needle is going into, in this particular example, is a painful muscle. Okay, the muscle is going to send a response through the nervous system. In this case, it goes to the spinal cord and it also travels up to the brain. So, as a general rule, you don't just get one response from this, you get multiple responses. Okay, you might get some decrease of pain saying, hey, we already know there's some damage here, you don't need to keep telling us that. Okay, number one. Number two, increase the circulation, which in turn is going to increase the body's ability to heal. So, you can use the acupuncture to enhance other treatments. Say, for example, you have your horse's hocks injected. Okay, so typically, traditionally you put some steroids in there, you might put some joint fluid supplements in there, and that is, the steroids are designed to decrease the inflammation, decrease the pain response in the joint. The joint supplement, the fluids that are added to that is to increase the health of the joint. So you can use acupuncture on top of that to stimulate the body to produce its own joint fluid and decrease its own response. Okay? Everybody? Shaking heads is a good sign. So, systemic effects for this, one is to release endorphins. And so endorphins is what makes you feel good. That is typically what you get if you think about a runner's high. You know, you're running, you feel like, okay, I'm going to keel over any second now, and then all of a sudden you feel this euphoric type of feeling. Okay, that's your endorphins kicking in, for starters, okay? And increased serotonin levels is going to realistically calm the nervous system down. So those are two kind of responses that realistically are going to, in large part, decrease your pain response, decrease the inflammation response. All of those things go together, so kind of get a systemic effect from that. Okay, so the advantages for the acupuncture in your horse, and this, in my opinion, is a really important concept. It complements Western medicine. It doesn't replace Western medicine, okay? So using it as the one and only tool, I truly believe is not the best approach. Having it be combined with other treatments and other modalities is definitely the most beneficial to your horse. So it can provide treatment for conditions before the clinical signs are apparent. So in part, I do what's called a DAPE exam before I actually place the needles in the horse. And that is an exam, if any of you have seen it before, or if you've seen me perform it before. Basically, I take, it's not really a high-tech tool. I usually take a syringe, a capped syringe, and run it along certain areas of the horse. And what I'm looking for is some kind of response to that as I go over the points that can be stimulated. So sometimes those responses vary quite a bit. Sometimes it's just a little muscle twitch. Sometimes it's the horse moving away from me. Sometimes it's a, I'm going to kick your face off response. That's not the best idea. Okay. But so sometimes it can be very subtle. And in those cases, oftentimes those horses, you don't perceive them to be lame. Maybe you don't think that there's anything realistically wrong with them. Maybe you think you've been to shows, they've been performing well, and they're just not quite up to par, or you've moved them up a level, which you think that they should be able to do, and they just aren't performing up to what you think they should. So in that particular case, there may not be any overt lameness, and there may not be a clinical problem yet. But if they keep going, there very well could be. So you're trying to catch those before they actually become a big problem. Can help control pain, and certainly I've talked plenty about the pain response in them. So particularly horses that have not responded to traditional NSAIDs, so bute, banamine, equiox. And again, I'm not saying that this is 100% a replacement for those medications, but it certainly can have an additive effect. So maybe you can decrease the amount of drugs that you give them, that kind of thing. Or maybe you give it only every other day or when you're going to a big show, that kind of thing, versus having them on maintenance on a daily basis. It can, in instances, help when Western medicine has not been effective. And I know I've said a whole lot about complementing Western medicine. There are some cases when it's just primarily the problem is vague and you can't really put your finger on it. So acupuncture can definitely, because again, it's going to measure the whole course, not one particular area. So things that are a really subtle lameness that can't be located to one leg or one specific area, that kind of thing, definitely acupuncture can help with those. Okay, because it's going to treat the entire horse, not just one aspect of them. And that is a big important point for me anyway. So part of the reason that the exams are so important is you can think about your own body. If you twist your knee and it's swollen and it's painful and you're hobbling around, the next thing that oftentimes hurts you is the opposite hip, right? Because you've been taking your weight off of one leg, you're putting all your weight on the other one, and now you've got another problem, okay? And the next thing you know, you're kind of all over body sore, not just in one particular spot, even though you have an injury that you know what the injury is, where it occurred, all that kind of stuff. If you think about it, or you've been on crutches, anything like that, anything that puts your body out of balance, you're going to have a counter effect to that somewhere else because you have to counterbalance your own weight. The horses are the same. So they've been favoring one leg for quite some time. You're going to get some response in an opposite limb, or if it's a front leg, you're going to get some response in a hind leg, that kind of thing. Okay? So, and of course, you have to throw in there, improves your horse's quality of life, as all treatment should. Okay, keeps them happy, healthy, doing what you want them to do, whatever that may be. Doesn't really matter what it may be. Mine do nothing but stand around and eat and poop all day. So, and they like it, and I'm good with it, okay? So, the treatment is very safe. There are very, very few side effects. I'd say the biggest side effect for the horses is some of the horses do become needle sensitive, and mainly it's not in theory. Of course, we don't know because we can't directly ask them. Is it hurt when the needle goes in? But the theory behind it is that they feel a response to it, and that's what they're reacting to, not necessarily the needle itself. To be honest with you, on all the ones that I've done, that's a very, very small number that have those kind of issues. And if they do, you just work, there's plenty of ways to work around that kind of stuff. Okay, so on that front, if you want, you don't have to. I'm going to make that clear. If you want, you can try this on yourself, okay? So if you, these are all sterile needles, and if you need another one, because you've played with it, let me know. Okay?
I played with mine.
So,
Sorry.
that's okay.
Okay, let's watch you guys do this.
So you will notice that these needles come in a little tube, right? So, and they're kind of set, kind of glued to the side of the tube. So the first thing that you want to do is take the handle end, which is the blue piece that's sticking out, and just release that from the side of the tube. So you don't want to take the needle out of the tube, and it'll pop. You'll feel a little pop.
She lost her.
Yeah.
There will be contributions at the door for those that don't. Okay, who wants another one? See, there's some skill involved in this, you guys.
Well, you're gonna kind of hold the top
It'll
as you,
click.
end up like this so it doesn't fall out.
Yeah. Yeah, get it out.
Oh, it's in a casing too?
Yeah.
You want it out of the casing now?
No, just release it from the side of the case.
You want it like this,
Oh, you just put it back on.
right?
Yeah,
You
just
hold
like
it like
this, and
this.
keep it in the tube. Okay, everybody good?
Yeah, we're good.
Okay.
Is that right?
Yeah.
Oh, don't just.
Okay, so if you're left-handed, hold it in your left hand. If you're right-handed, hold it in your right hand, because I'm left-handed, so I'm going to show you with my left hand, okay? Are you ready, everybody? So, right here in the little web of your hand, between your thumb and your forefinger, there's a little, like, fleshy part.
Yeah.
Okay? So, you're going to put the tube right on the fleshy part. Okay, and then you have the needle sticking out of it, so it's going to stick out just a little bit. Okay, ready, everybody?
Yes?
Okay. Then you just take your index finger and just push down.
Oh, I don't know about that.
Want me to do it for you?
Sure. I'm in the right place?
Okay, it's in there.
Sorry.
That's okay.
I'm shaking. I know, I also said delivery, yeah.
Okay.
Okay.
Okay, so when you can leave them. Everybody good who wants to do it?
No, that's okay.
She dropped. You want another one?
No, I'm really.
He wants to do it.
Just regular acupuncture.
You want me to do it for you? Yeah. You want me to do it for you? Okay.
Better than a shot.
Okay, everybody good? Not good?
I'm good.
Do you want me to do it to you?
Sure. Yes. Yes.
Are you gonna do it? It's actually
I've had all of my feels before.
I haven't put it in there yet. You said ow. Okay.
What are we fixing with this?
large intestine 11 on people. So
Large intestine and
11. That's what it's called, large intestine 11.
Okay.
Oh.
Okay, so if you want to, you don't have to, because you can kind of, at least I can feel it tingling. So
Yes.
It's just about like an eighth of an inch or something in there, the end of it, when you don't puncture it out, but it comes to the end.
yeah,
So that's all you're inserting then, is just a very little.
right at the moment, yeah. Okay, so if you want to, you don't have to. You can insert it a little bit further, and how you would do that is take the, put your index finger and thumb on the needle itself, not the handle, but the needle itself, and you're going to twist the needle into your skin. So just kind of, doesn't matter what direction.
And that'll cause more poking, right?
It'll cause it to go in a little bit further, but what it's going to do is it's going to wind those muscle fibers, tissue fibers around the needle, and you get a bigger stimulation from that. So for me, I can tell you right at this moment, my fingers are tingling now.
Oh, it's that.
Yeah, that means it's getting stimulated.
I don't know if I got it in further, but I twisted it.
It just feels, it hurts.
Okay, everybody good?
Yeah,
Didn't hurt that much, right?
no,
And you have to kind of keep in mind, this is a pretty sensitive area of your body.
really.
Yeah. Okay?
What happened?
So, that's it. It sits there. How far can you go in? Well, on your hand, not that far, because you're going to end up going through. But realistically, on the horses, I might go maybe half an inch, kind of depends. Definitely, you don't want to get up towards the handle itself, because that's the weak point, and if it starts moving and that kind of stuff, it's going to break off. So for the horses, we typically leave them in 20 minutes or until they fall out. So when they're done, and it depends on the horse, and it depends on how much inflammation there is. Sometimes the needles will move, sometimes they get bent, and I've had them come out where they look like zigzags instead of straight.
Watch the needle.
So sometimes that happens. Sometimes the tissue fibers release before the 20 minutes and the needle ends up laying down, and then it's done and you take it out. So it kind of depends on what it is you're treating and where and all that kind of stuff. So when you, yes?
I dropped mine and I can't find it.
I'm sure there's a good point there too. Okay, so when you want to take them out, you just do the reverse. So you twist a little bit and pull out, okay? And then I oftentimes will rub the area just to kind of close it, closing the chi hole. Okay, so that's what it's
So
called.
for intestine 11, how long would you leave that in a person?
20 minutes or until it falls out.
And how deep did you go on a horse?
On a horse, it depends on the area I'm treating. Back in their butt, probably half inch, 3/4 of an inch. Yeah.
Go.
Yeah.
So can I
But
have a
they
couple
can
of those
be right
for
at the skin
left
surface
knee?
and still have a response. Sorry?
I said, can I have a couple of those for left knee? Joking.
I need some for my hip,
So,
What is that?
just kind of depends.
my hip.
Okay?
Is this the same needle that you use?
On the horses,
Yes.
this is absolutely these are the horse needles.
This is what?
Why don't
It's not a horse needle.
they don't break though when you're going through their skin, huh?
They don't. They are, and I have a couple of slides of this also. They're silicone coated, so they have some plastic or realistically coating on them. And they also, even though everyone went ow, the ends of the needles are realistically pretty dull. So they're
Really?
actually rounded tip needles. So that's why.
So everybody can go home and say, I had a horse-sized needle in my hand tonight.
Yeah, they do use these on people as well. I mean, that's probably the upper limit on the people front, but certainly lots of people use them.
It's like thin as a hair.
Yeah, it's really tiny, really tiny.
Do they run electrical current through them, like I've seen in physical therapy?
Yeah, you can connect two together and run a current through them, yeah.
Yeah.
Yeah. So, and I would say some of the horses are a little bit more responsive to that,
Yeah.
because you can feel the current going through them.
Yes.
Yeah.
So for a normal treatment, would you put it like both sides? Like if I went in to get
Yeah, if I
acupuncture for my
do-
intestine, would they do both or
If
just
I
one?
do a treatment, everybody's a little bit different and kind of depends on what philosophy you follow and all that kind of stuff. Yes, if I treat a point on one side of the horse, I treat it on the other, yes. So
Okay.
it's a match.
So for the horses, for sure, you would do
Yeah.
that.
So if someone's coming in, you're gonna analyze how they walk and move and determine where you're gonna work on their body,
Yeah, a
right?
little bit kind of depends on the history of what's happened. If, say for instance, Dr. Lon has looked at the horse, then I will get a history and complete workup and all of those kind of things from him. I may watch it walk, but I'm not gonna realistically repeat everything that he's already done. So I will take his information, do my own exam, and then treat what I see. Because again, you're not just trying to treat one area, I'm trying to treat the entire horse.
Yeah.
Would be, if you want to use a medication example, it would be similar to you having your horse's hocks injected versus you treating them with Atacon. Atacon's going to treat the entire horse and all the joints. The injections themselves are going to go specifically into those joints. So it's an overall health versus just one particular area. So, what does acupuncture treat? Just about anything. Very commonly musculoskeletal and neurologic problems. So, lameness types of issues, joint related, tendon related, muscle soreness related. Some of the neurologic problems, if they have muscle damage, it's not going to treat things like EPM, for example. It's not going to treat that disease. However, once the disease has been treated with medication, can it help stimulate the nerves to reroute into areas? Yeah, absolutely. So it's going to have a little bit different effect. You still have to treat the primary cause of those kind of things. Okay, is it going to treat an infected sinus? No. Because it's not going to treat the infection itself. Can it, once the infection is under control, can it help the body promote healing and heal faster from that? Say, for instance, the sinus infection is due to a tooth, a tooth that's infected. The tooth gets removed. Now that infectious process is gone. Can you use acupuncture to promote healing? Absolutely. Okay. So skin problems, and those are primarily, would be things like help with wound healing to promote circulation, that kind of thing, and promote healing properties within the body itself. Allergy type of situations, the itchy skin, horses, that kind of thing. So that's kind of more the skin things that you're looking at for that. Gastrointestinal disorders, so things like colic or diarrhea. Again, really a lot depends on as far as when you're going to use the acupuncture to treat those. What is the cause of the colic? If it's an intestinal stone in there, that requires surgery. However, can you use acupuncture after the fact to promote healing and promote intestinal movement? Absolutely. Okay, you guys see the difference in all that stuff? I'm not saying this is the end all, it's going to replace everything, but definitely can be huge benefit to other treatments that you're using for these guys. Okay, so again, the list is pretty extensive. Respiratory disorders, again, that's mostly allergy type related. Promote healing after infectious processes are done, that kind of thing. The one thing, reproductive problems, so that would be things like having difficulty getting them in full. Just like humans, it's not recommended for those that are pregnant. That's human medicine and...
Not recommended?
Pregnant, when you're pregnant. Wait till after the fact on that kind of stuff. The other instance it would not be recommended is any kind of cancerous type of process, because it's going to promote healing and promote cell growth, and that's definitely not something you want in a cancer type of situation. Okay, so will it hurt? Is it gonna hurt your horse?
No.
No, it's not, because you all are still around. Okay, so most of them are stainless steel. They have, some of them have steel heads or steel handles that go along with them. I happen to like the colored versions. One, because as you've already seen, they are much easier when you lose them to find them. Number one. Number two, different colors mean different sizes, so it's easy to recognize what sizes you're putting in what area, okay? So that's kind of the reasons why I like those. It's really a personal preference. So they're very small diameter. You already have experienced that as well. They separate the tissue versus puncturing all the way through, and that's why it doesn't hurt quite as much as it could. Okay, so when you take a stainless steel needle and you insert it with a vaccine, or you take the needles that we typically use with the vaccines, those are going to cause tearing all the way through the tissue. Okay, these primarily separate the tissue, so it's a little bit different and less damage. One, because they're smaller, and two, because they are designed to do that. Okay, they are silicone coated. Again, some of them are not, but I feel the horses tend to respond a bit better with that coating over it, so the needle slides through the tissue a little bit easier. Okay, whether you thought it did or not in your hand, it could hurt worse. Okay, so that's why I use those particular needles. So, some horses just like you, and this is where, again, we don't feel that, as far as anyone can realistically tell, they respond to the needle placement per se. But sometimes they'll feel some heat in the area, sometimes they'll feel some tingly or twitching, sometimes they don't know what that is and it scares them. So that's the reason why some of them may be a little bit less than enthusiastic. Okay, so again, if I do a couple of sessions and I feel like the horse is getting a little bit upset about it, maybe I won't put so many needles in at one time, kind of temper the response. And that's certainly a doable thing. You treat some points, take those out, treat some other points, that kind of thing. So, it's like anything else with these guys. Have to work with them in order to get the best benefit. Okay, so on the electro version, realistically, those horses, I usually sedate them lightly just because they can feel that you hook up. It's kind of like if you were going to jump your car. That's kind of what it looks like. You have two needles, you put your positive wire on one, your negative wire on the other, and the current goes between them. And they can feel that going underneath their skin. Because I did that to myself too, so I know they can feel it. Okay? So, and sometimes that just, it scares them. Because they don't know what it is, and they don't know how to respond to that. So, okay, so this particular treatment is treating primary back pain, and there are quite a few points that go along the top line of their back. And certainly those are very common areas to treat. And I would say 90% of the time, if I'm treating the horse, it doesn't matter what I'm treating it for, I can find some back-related problems. That's just the nature of them. Big, heavy animals, a lot of them, longer back ones are typically going to have worse problems and that kind of thing. Okay, so that's a very common scenario. This is being used to promote healing. Okay, so it's called circling the dragon. It goes all the way around, and that's going to promote healing in that tissue. Okay, so once the needle is placed, as a general rule, the horses don't react. The horses are standing there, they're completely fine. I've had one in particular that that was not the case, but for the most part, once they're in and they're set, they typically hang. Okay, a lot of them will kind of fall asleep, their muzzle or their lips will drop. Some of them, I've had them drool and have drool like hanging all the way to the ground. So it just kind of depends. Once everything is set to go, they pretty much send out. And so that's another thing, that if you go to a human acupuncturist, and realistically in small animal medicine as well, they put you in a nice quiet room, they usually put some mood music on. A lot of times in human medicine, they'll place the needles and they'll walk out of the room for 20 minutes. Okay, so it is a Zen experience, and that really helps with the horses as well. So try and promote that aspect of it. It's supposed to be a good experience for everyone. Okay, so how many treatments do they need? A lot of it depends on the condition that you're treating. The other thing that a lot of it depends on is acute problems. So problems that just started, that's what acute means. So those problems that have just started, they typically respond quicker because the body hasn't been compensating for quite as long, okay? So there is no one set rule to how many treatments is it going to take. It really is horse dependent. Just like we can't tell you how many joint injections are going to be needed through the horse's lifetime. We can't tell you that. Okay, so some of it depends on their use, how much damage there is, how well they respond, all that kind of fun stuff. So the acupuncture is very similar to that. So in general, do try and give them, realistically what we would consider a loading dose. So for example, if you're familiar with Acupuncture and you've used that in the past, the loading dose to kind of get a high level in their system is 1 dose every 4 days for 28 days. That's the accepted. That gets a high level of Acupuncture through the system, helps promote the joints, all that kind of fun stuff. So for the acupuncture, 3 to 4 treatments is typically the general rule. 3 to 4 treatments, 1 week apart, to try and promote those tissue cells in the body to respond, to decrease inflammation, promote healing, all that kind of fun stuff. So beyond that, typically the time frame drops down quite a bit. Sometimes they need maintenance once a month. Sometimes they need maintenance once every couple of months or once every 6 months. Again, it's horse dependent and what you're doing with them, all that kind of fun stuff. So there's no one set answer. I will say that if I haven't seen a response in 3 to 4 treatments on the initial response and talking to you guys, the owners, on how you feel the horse is doing, then we start looking for another cause. Okay, something that has not come up on my exam, that's not come up on the traditional diagnostics, x-rays, ultrasound, whatever the case may be, okay? So what can you expect after treatment? And there's a couple of responses that can occur. So you can see initially, and we're talking about the first 24 to 48 hours after treatment. You can see no change, no obvious change, so the horse kind of looks the same. But maybe they're a little bit brighter, or maybe they're a little friendlier, or maybe if they weren't friendly before, they're a little bit more naughty. Okay, so kind of depends on their personality. So realistically, after you take the needles out of the horse, or you guys out of your hand, you can see stimulation on those nerves for up to 24 hours after the needle is removed. Okay, the body still responds to that. So just because the needles are removed, and that's why if the tissue has been stimulated and it relaxes and releases the needle, it can come out, it's done, okay? The tissue is still going to respond further than that, even if it hasn't been in there 20 minutes. Sometimes they only last, 5 minutes, just kind of depends, okay? And oftentimes I will have needles that are straight up and moving, because you can actually see the muscles twitch on some of them and move back and forth, and you pull them out and they're bent. And you will see that on the first treatment. By the third treatment, that needle's falling out in 5 minutes. Okay, so it's getting, that area is definitely responding to the treatment. Sometimes you will get an immediate response and they feel much better, and I've had that happen where people feel walking away from that treatment, they are better already. And so you get an immediate response, and then you get a response that's going to continue to improve the condition. Sometimes you will have a condition that looks worse for the first 24 to 48 hours. So if they were lame before the treatment, they are a little bit more lame after the treatment. A couple of days later, they improve after that. So just because they are a little bit worse after the initial treatment, that doesn't mean it's not going to help or it's caused some damage. It's just has stimulated the nerves, and the body has responded by saying, hey, that hurts worse now. but then you get the tissue healing responses and all that kind of fun stuff, and they feel better after the fact. So everybody wants to know how much it costs. So it's always the thing. Okay, so coffee out to your house is the standard, $82. You bring them into the hospital, it's $27. Okay, that's a pretty standard.
Wait, how much?
82?
If you go to them,
Mm-hmm.
bring them to the hospital,
It's 27. 27.
plus
The hospital fee is 27. Yeah. Plus the treatment, yeah.
and how much is the treatment?
Okay, we're working on it. Okay.
That's what you need to know.
Okay, but I can't emphasize this enough. You have to have a valid diagnosis in order to get the most benefit out of this. That's a step that cannot and should not be skipped. Okay, so it doesn't even have to be realistically, I mean, honestly, from this clinic. It could be any veterinarian. It doesn't matter. Okay, somebody needs to diagnose the problem, or at least have a better idea of what the problem is. Because if they haven't done it, I'm going to. Okay? Make sense, everybody? Because that's how you're going to get the most benefit out of this. So, your initial treatment, and I'm not sure these are correct now, to be honest. Yeah, they are. Okay, so the initial treatment, so you have your call fee or your hospital fee, whichever that may be. The initial exam is $65, and I often, when they answer the phones in the reception area, why does there have to be an exam? There has to be an exam in order to know what to treat. I mean, that's just no way about it. And that way I can figure out, okay, so they're being seen and being treated for, say, for instance, a suspensory tear on their, a tendon tear on their right front leg, and now they have some left hip pain. Okay, and I wouldn't know that without doing the exam. Just like if your horse has a snotty nose, we have to examine it and listen to its lungs and take its temperature and do all that kind of stuff in order to figure out, is this an infectious process? Is it allergy related? You know, what do we think? Okay, so there's an exam that goes with those. The initial treatment is $130, so that's placing the needles in, and I often get this, it doesn't matter how many needles I put in, because I often get that question as well. It doesn't matter. So I will say, as a general rule, on the first treatment, I tend to put less needles in so that the horse can kind of get used to how the needles feel. So usually on the first appointment, I'll do my initial exam. I might watch them walk or trot, definitely get a history, that kind of stuff, do my initial acupuncture exam, and then I try and treat the big areas, so the big nerve endings that are going to stimulate the most without sticking a million needles in them, so that they don't get overstimulated all at once. Okay, so that's typically how I kind of do things. Follow-up treatments, the recheck exams are $45. The treatments beyond there is $100 a piece. And then there's a $5 medical waste, which I didn't put on there.
That's all in-house, right?
These prices are in-house or at the stables. It's just either the call fee to go out or the hospital fee to come in.
The first.
Yes.
What does DAPE stand for?
Diagnostic Acupuncture Physical Exam. Yeah.
Is treatment more beneficial in-house or at your home?
You know,
More relaxed?
It kind of depends on the horse. If they are very nervous in here, to be quite honest with you, they'd be better off at home. Because again, it's supposed to be a little bit of a Zen type of, yeah. So if they get in here and they're prancing around and all those kind of things, they may very well be better and respond better at home. Yes.
You talked about if the horse is nervous. I'm curious, could this help a nervous horse?
It can help some of the nervous conditions, yes. However, just like if the horse is already nervous and you try and sedate it, it doesn't oftentimes work out that well. Same thing can happen here. If you're treating them for nervous behavior, you're better to treat them before they get nervous. Before they get nervous, so they get a better response from you. Anybody else? Nothing?
I saw a karate movie where there was a scene where there was a doctor, acupuncturist, performing a treatment, and there was like, to me, it appeared there were larger needles.
They do. There are definitely people out there that use, I went to a talk in December, that veterinarian used foot-long needles.
Yes,
I have never had a need to do
This
that.
is Hollywood, but at the end of the needles was like, looked to me like incense was burning off of them.
Yeah,
Keep
and
the
some
needle?
people do those, yeah, those are moxie
Yeah.
treatments, yeah, yeah.
Those are not for horses, though, right?
You know what? Some people do use them on the horses. In my experience, most of them need to be sedated for that because they don't like the smell.
Yeah.
Yeah,
Moxie?
moxie, yeah.
How'd you spell that? Just,
How do you spell it? I have no idea.
but you don't do that, right?
I don't know.
We don't need
I haven't really, honestly, had a need for it. I mean, most of what I do is just straightforward place dry needles. I really haven't, I've had a couple of sessions where I felt like electroacupuncture, that's hooking them up to the little battery thing, has been beneficial. But I really haven't had a need to do a whole lot of that. Or some people, excuse me, will inject B vitamins into the area or water, excuse me. And I haven't had the need to do any of that. Oh, I'm fine.
Okay, Mom?
She says, oh no, there'll be no dinner tonight if she kills over. And I think that's a lot of personal preference conversation.
Chiropractic treatments, do you recommend them in conjunction or before?
Yeah. Yeah, and for me, it doesn't make a difference before or after. The chiropractors like it before.
Okay.
So they like to have an acupuncture treatment done before they get there. So they, as a general rule, feel like they get a better reading on where they feel the problem is when they come into there. They can kind of cool my jets and relax. But is it 100% necessary? No. And they certainly, there's no reason to give them a bunch of time off or do anything like that. They can go back to work the next day.
I've had a gentleman who does body works on horses and prefers, of course, cool, not system stimulating, so that he
Yeah.
gets a better feel for, as
Yeah.
opposed to what is
Yeah.
already all.
Yeah, because if their tissue is warm for that particular case, it in theory can mask some of the responses that he's going to get.
The two different.
Right, right. Anybody else? Yeah.
So, when you come out on the exam and you actually put in all the needles, you typically wait 20 minutes?
Oh, yeah, yeah,
And then you take them out after?
yeah, yeah. Yeah, I don't leave you hanging. No,
I'll take them out in 20 minutes.
yeah, you'll be good to go. Just make sure you count them all. So, no, I stay, chat, whatever, or if you have something to do. But yeah, I stick around, take the needles out for you and all that kind of fun stuff. So
How often do you see bent needle?
I would say maybe 70% of the time. Yeah,
Often.
yeah. Often see them moving, which is cool and a little creepy all at the same time. Because sometimes they go like this, like this.
But then you see that it's working.
Yeah. Well, and that is a good, that's like a good promotion for me. See, look, it's, so.
Do you ever get a bleeder?
Every once in a while, yeah.
Depends on where you're at.
Yeah, I mean, you can hit up the end of a little capillary. It's not that big of a deal, but not too terribly often. I would say most of the time, if I have something bleed, it's down towards the feet.
Oh, off question. Could you or any
acupuncturists, anybody who has knowledge of doing, treat themselves if they wanted to?
In theory, yeah. Do I? No. Nor do I treat anybody at the clinic that asks me up all the time. So, yeah. But yeah, in theory you could, yeah.
So is like a horse the same as like a dog or a cat? Would it do the same thing?
Yes. The points are different places, but yes, as far as treatment-wise, yes. the same.
Don't throw the needles in the trash.
What?
Don't throw the needles in the trash.
Well, we throw them in medical waste, so,
Yeah.
yeah. Yeah.
Have you tried it on foals that have with a guide foal?
No, we have not. Although, I know, I'm getting the thumbs up back there, and that is an excellent idea.
Rather than a rope.
Yeah. Luckily, so far, we've only had maybe one this year, so, yeah. But that is an excellent idea. If it works, we'll credit you. Okay, anybody else?
Yeah, I have a question. You're working on the horse's right flank there. Would that be that you're working to stimulate something in that area, or would it be farther away from where you're working?
This one?
Yeah.
This is actually, I'm doing an exam on it. So, yeah. So I have a little end of a needle that I'm
So
running over there.
How far away from insertion would you be stimulating?
Depends on the nerve. Depends on the nerve. So sometimes some of the spinal nerves will start somewhere up by their neck, and they can treat all the way. The end of that nerve is going to be down by their butt.
Awesome.
Yeah, so it just kind of depends on what you're looking at. Okay, so we have a treatment